Eggs are a staple in many diets, known for their high protein content and nutritional benefit. However, not everyone can enjoy this popular food. Certain medications can interact with the nutrients in eggs, leading to adverse effects. In this video, we'll explore why you should avoid eggs if you're on specific medications, with short stories illustrating these interactions. 1. Blood thinners. Warfarin. Maria loved her morning omelet. Every day, she whipped up a delicious mix of eggs, cheese, and vegetables. But Maria was also on warfarin, a blood thinner prescribed after her heart surgery. One day, she felt unusually dizzy and had unexplained bruising on her arms. Her doctor explained that the vitamin K in the eggs was affecting her medication, making her blood too thin. Maria had to cut back on her favorite breakfast to avoid further complications. Warfarin works by inhibiting vitamin K, which is necessary for blood clotting. Eggs, especially the yolk, contain moderate amounts of vitamin K, which can interfere with the effectiveness of warfarin, leading to either excessive bleeding or clot formation. 2. Cholesterol-lowering drugs. Statins. John had been on statins for years to manage his cholesterol levels. He was health-conscious and often ate eggs for breakfast, believing they were a good source of protein. However, after a routine checkup, his doctor noticed his cholesterol levels were not improving as expected. It turned out that the cholesterol in eggs was counteracting the effects of the statins, making them less effective. John had to reduce his egg intake to see better results from his medication. Statins work by reducing the amount of cholesterol produced by the liver. Eating cholesterol-rich foods like eggs can counteract this effect, making it harder to manage cholesterol levels. 3. Antibiotics. Tetracycline. Lisa was prescribed tetracycline for a bacterial infection. She was careful about taking her medication on time, but didn't realize that her breakfast choice was affecting its absorption. Every morning, she had a plate of scrambled eggs, but her infection wasn't clearing up as expected. Her doctor informed her that the calcium in eggs was binding to the tetracycline, preventing her body from absorbing it properly. Lisa had to skip the eggs until her course of antibiotics was finished. Tetracycline antibiotics can bind with calcium, which is found in dairy products and eggs. This binding prevents the body from absorbing the medication effectively, reducing its ability to fight infection. 4. Diabetes medications. Metformin. Paul had been managing his diabetes with metformin for several years. He always ate a hearty breakfast of eggs and toast, thinking it was a balanced meal. However, he started noticing that his blood sugar levels were fluctuating more than usual. After consulting his doctor, Paul learned that the fats in eggs could slow down the absorption of metformin, leading to unpredictable blood sugar levels. 5. Blood pressure medications. ACE inhibitors. Anna was on ACE inhibitors to control her high blood pressure. She enjoyed eggs for breakfast and never thought they could be a problem. However, she started experiencing lightheadedness and fatigue. Her doctor explained that eggs are high in potassium, which could increase the potassium levels in her blood when combined with her medication. Anna had to monitor her potassium intake to avoid potential complications. ACE inhibitors help relax blood vessels and reduce blood pressure. They can also increase potassium levels in the body. Eating potassium-rich foods like eggs can lead to hyperkalemia, a condition characterized by dangerously high potassium level. 6. Thyroid medications. Levothyroxine. Sarah had been managing her hypothyroidism with levothyroxine for several years. She was meticulous about her medication routine, always taking her pill first thing in the morning on an empty stomach, as her doctor had advised. This routine helped her keep her thyroid levels in check, and she generally felt good. However, Sarah loved eggs and often had them shortly after taking her medication. Gradually, she began to notice that her energy levels were dipping, and she was experiencing some of the symptoms of hypothyroidism again: fatigue and weight gain. Concerned, she visited her doctor, who explained that the proteins in eggs might be interfering with the absorption of levothyroxine, making the medication less effective. Levothyroxine is best absorbed on an empty stomach. Certain foods, particularly those high in protein like eggs, can bind to the medication and reduce its absorption in the intestine. This means that the medication may not work as well, leading to suboptimal control of thyroid hormone level. Sarah realized that by eating eggs too soon after taking her pill, she was inadvertently making her condition worse. Her doctor advised her to wait at least 30 to 60 minutes after taking levothyroxine before eating, especially if her meal included eggs. With this adjustment, Sarah noticed a significant improvement in her symptoms, proving how crucial timing can be when it comes to medication and diet. 7. Immunosuppressants. Cyclosporin. Tom had been on cyclosporin ever since his kidney transplant, a medication essential for preventing his body from rejecting the new organ. He was cautious with his diet and lifestyle, knowing how important it was to keep everything in balance. However, Tom had a fondness for eggs, which he enjoyed almost daily for breakfast. Over time, his doctor noticed that Tom's cyclosporin levels were fluctuating, and his kidney function tests were inconsistent. This was concerning, as stable medication levels are crucial to preventing organ rejection. After reviewing his diet, the doctor explained that the cholesterol and fat content in eggs could enhance the absorption of cyclosporin, potentially leading to toxic levels of the drug in his bloodstream. Cyclosporin is a powerful immunosuppressant, and its absorption can be significantly affected by the fat content in the diet. When foods like eggs, which are relatively high in cholesterol and fat, are consumed, they can increase the absorption of cyclosporin, leading to higher drug levels than intended. This can increase the risk of side effects, including kidney damage, hypertension, and other serious complications. Tom had to modify his diet, reducing his intake of eggs and other high-fat foods, maintain a more stable level of cyclosporin in his system. With these changes, his medication levels stabilized and his kidney function improved, highlighting the delicate balance required when managing a post-transplant diet. 8. Antidepressants. MAOIs, monoamine oxidase inhibitors. Emily had been struggling with depression for years before her doctor prescribed MAOIs, a class of antidepressants known for their effectiveness in certain cases where other treatments had failed. While these medications helped her significantly, they also came with strict dietary restriction. Emily enjoyed her daily breakfast of eggs. Soon after starting the MAOIs, she began experiencing severe headaches and episodes of high blood pressure. Confused and worried, she consulted her doctor, who explained that the amino acids in eggs, particularly tyramine, could interact dangerously with MAOIs, leading to a hypertensive crisis. MAOIs work by inhibiting the breakdown of monoamines in the brain, which helps alleviate depression. However, they also prevent the breakdown of tyramine, an amino acid found in certain foods like eggs, which can cause a significant increase in blood pressure. This interaction can be life-threatening if not managed carefully. Emily learned that while on MAOIs, she had to avoid not only eggs, but also other high-protein foods that could contain tyramine. By strictly following these dietary guidelines, Emily was able to continue her medication without further incidents, but it required constant vigilance to ensure her meals did not include foods that could cause dangerous interaction. 9. Hormone replacement therapy, HRT, estrogen. Linda had been using hormone replacement therapy, HRT, to manage her menopause symptoms, including hot flashes and mood swings. She felt that the therapy was helping, but she was also noticing some unwelcome side effects, such as weight gain and bloating. Linda prided herself on maintaining a healthy diet, which included eggs, a food she considered nutritious and beneficial. However, during a routine visit, her doctor pointed out that the cholesterol in eggs could be exacerbating these side effects by influencing her estrogen level. This was news to Linda, who hadn't considered that her food choices might be affecting her HRT. Estrogen, the primary hormone in many forms of HRT, can interact with the body's cholesterol metabolism. Consuming foods high in cholesterol, like eggs, can lead to an increase in estrogen levels, which might worsen side effects such as water retention, bloating, and weight gain. Linda's doctor suggested that she reduce her intake of eggs and other high cholesterol foods to help manage these symptoms better. By adjusting her diet and paying closer attention to how certain foods affected her body, Linda was able to find a balance that allowed her to continue HRT with fewer side effects, demonstrating the importance of dietary awareness when undergoing hormone therapy. Number 10. Anti-gout medications, allopurinol. David had been dealing with gout for many years. and had been prescribed allopurinol to help manage his condition. This medication worked by reducing the amount of uric acid in his blood, preventing the painful flare-ups that characterized his gout. David loved his daily meals, which often included eggs, and considered them a safe and healthy option. However, he began noticing more frequent gout attacks, despite taking his medication regularly. Perplexed, he visited his doctor, who explained that eggs, which are relatively high in purines, could increase uric acid levels, counteracting the effects of his allopurinol. Allopurinol is designed to lower uric acid production in the body, but its effectiveness can be compromised by the intake of high purine foods, including eggs. Purines are substances found in many foods, and when they break down, they form uric acid. Consuming a diet high in purines can lead to an increase in uric acid levels, making gout more difficult to control. David's doctor advised him to reduce his consumption of eggs and other high purine foods to better manage his condition. By making these dietary changes, David was able to reduce the frequency of his gout attacks and improve his overall quality of life, illustrating the critical role that diet plays in managing chronic conditions like gout. Eggs are nutritious and delicious, but they may not be suitable for everyone, especially those on certain medications. If you're taking any of these medications, it's essential to be aware of how your diet might interact with. Always consult your doctor or a healthcare professional to ensure that your food choices align with your treatment plan.